going to start with just assessing convergence insufficiency, because that's something we see quite a lot of in concussion. So, as I said, we would normally expect, depending on sort of age and your visual acuity, for that to be sort of round about sort of 6 centimetres, 10 centimetres there. So what I'm going to ask you to do is just to pop that onto your cheek, and then I'm going to just ask you to slide this towards you and tell me when that X becomes 2. Lovely. So we can just bring that in. Nice, simple way of doing it. And Susie, you'll be pleased to know that you're normal.
Should we try and give Susie a concussion so that you get some positive? No?
I think that would be a bit cruel. So that's just sort of how we would assess convergence insufficiency. If it wasn't normal, then we'd be wanting to give some exercises for you to practice with that. So what we would usually do, again, I'm not an optometrist, I'm not a behavioural optometrist, so I would do sort of baseline. If you had a problem with that, I would get you doing something called pencil push-ups, which isn't as strenuous as it sounds. What it basically means is you bring a pencil in towards you, you keep tracking the pencil as it comes into you. Then you would look away at something in the background, and then you would look back to the pencil, away to the background, back to the pencil. And so that you're working on bringing that pencil in and just seeing one pencil. The other one that we would use is called the Brock strings, which is a string with 3 beads on it. And again, looking at getting you focusing on each one so that you're able to sort of alter that length and gradually bringing them in. That would probably be as far as my remit went as a physiotherapist. If they weren't doing the job, then I would be wanting to refer onwards to a behavioural optometrist.
And I always ask this question when anybody talks about giving exercises of any sort. How many times have I got to focus on the pencil, and how often per day?
So because we're retraining the brain, then little and often. Mm-hmm. So again, it's around sort of, particularly with vestibular and concussion, it's around giving the brain a bit of an error message so it knows what it needs to correct, but not overwhelming it with a big error message, so that it just feels very symptomatic and you don't get any learning.
Right.
So that's sort of the sort of very, very individualised, the prescription of exercises. So in some patients, it may be 2 seconds. In others, it may be 30. Okay. And we ask them sort of, to do it, rest and let any symptoms subside, do it again, rest and let any symptoms subside, do it a 3rd time, and do that 3 or 4 times a day. Again, if that's not tolerated, we may have to wind it back, but it's around sort of that frequency to retrain the brain. We want a tiny bit of increase in symptoms, otherwise there's nothing for the brain to recalibrate. But if it's a big increase in symptoms, you're just going to go, oh, I don't feel well. And then you're going to not like your physio. We try and avoid that.
You can go and see an osteopath.
Oh, harsh.